This is the FM Gold channel of All India Radio. In the program Spotlight, now we bring you a discussion on government initiatives and preparedness for coronavirus. The participants are Dr. Narendra Kumar Saini, former Secretary General, Indian Medical Association, and Rhythma Kaul, journalist.
So we will be talking about coronavirus today. How grim is the situation?
I think if I see worldwide, this is a grim situation. If you see China, within this 15 days or 20 days of time, I say 31st of December, we have reported one case, and from there 17,000 cases have been reported from China alone and 150 from rest of the world. Now the world is moving very fast. Interconnection is very much there. So the situation is grim because number of cases are increasing day by day, and that 360 deaths are there. And it is a very transmissible virus. It means transmission rate is high. So that's why this is a problem.
Mortality rate but is very low. It's 2%.
2%. But if transmissibility is very high, if in this short period of time it becomes so high in transmitting the infection, so 2% will become very high because number of people affected will be more. So if the number of people get infected more, so 2% becomes very high.
So what is the solution right now? Short term and long term?
The short term solution at present, we should know the facts. The facts is normally whenever the virus or bacteria enters into the body, we have some antibacterial drug or antiviral drug. Coronavirus is a virus infection. Right now, whatever research has happened, there is no antiviral drug which is effective against it. And secondly, there is no vaccination. Two things have to be kept in mind when we're talking about the short-term solutions. So in that case, it becomes the only thing remains is a preventive. And those who are having infections, for them is a symptomatic treatment. They should report as fast as possible to the medical professionals. And that too, qualified medical professionals. Because we are finding some news, this can be cured through some homeopathic drug or allopathic drug or some Ayurvedic drugs. Right now, everybody has to understand, as per the WHO statement, there is no as such a complete treatment for this virus. Only treatment remains is a preventive treatment and secondly the symptomatic treatment. So for prevention of this, very important is that we should be keeping a distance from a person who is supposed to be having such kind of infection. One. Second, if somebody gets an infection, then yes, we have to give a symptomatic treatment and he should be or she should be kept isolated from rest of the community.
Why is the isolation important?
The symptoms of this virus is, before we say that why it should be kept isolated is, we should know the symptoms. Symptoms in these cases are cough, fever, running nose. What happens is, when we cough, another thing we have to keep in mind is, everybody must have read that it is through the seafood it is happening.
Has that been confirmed?
Yes. It has been confirmed that it is from the seafood because number of cases which you see the original doctor who has seen this case, he saw that there is a patient who is coming for running nose, cough and some little bit of breathing problems. And then he found that the next day 3 or 4 patients from the same family has come. Then he traced down. He found that this has come from a market they were visiting. That was seafood market. So, and it has been known that coronavirus is mainly present in bats. So from there, probably the reason is that snake has become a reservoir in this. So snake has come in between. From snake to human has come. The biggest issue now is the animals are not required. Seafood is not required. It's a human to human transmission is there. That is a problem. Still it is from animal to human being, that's fine. Then you can restrict it. But once it becomes human to human transmission, and that too through a mechanism which is airborne, the infection is through an airborne. It becomes more infectious because when we infectious, one is through the air it goes. Second is when we vomit, when we cough, everything which comes out from my mouth, on my surrounding it is also settling down. And it is not killed straight away when it comes to surrounding. It survives in the surrounding also. Some estimates are there, it may survive up to 5 days in the surrounding. So wherever I am touching and somebody has come and he has coughed and you are suffering from this kind of a fever and I come over there or any person comes over and touch those surrounding, from the hands, it take away those viruses. And once this virus comes over to my hands and I put my into nose or in my throat or in my eyes, and through these things also it can transmit. So it becomes very problematic things. The transmission rate, that's why it is high, because it is invisible way of transmission.
So do masks help because it's an airborne infection? Masks and hand hygiene, these are two important.
I will say it is difficult to wear masks all the time, one. Second, the mask has to be which is tightly fitting into your mouth and nose. What happens is, there mostly masks are there, They are cosmetic in nature. You just apply it and you find from side and from this side, there is a lot of entry points are there. If this virus enter through these points, then obviously one is not going to be helpful in this case. Secondly is that we are using this mask in a mask campaign. What happens is you have put the mask and it remains for a longer period of time, but your mask, once it is wet, it becomes useless. And secondly, I am putting my hands on the front of this. And this front of the mask contains most of the viruses because every virus which is coming over here, it is sticking to it. What happens if I'm keeping it for a long time and go home? What I have seen is people are putting this mask and whenever they come home, they put it down. So what happens is when you put it down, the front side becomes down. It comes on your shirts, on your clothes which you are wearing, and then you touch with your fingers and then it goes. So important way of preventing this will be only a hand washing. Very, very important. We must have a hand washing. Person who is supposed to be having infection, he should wear mask so that he is not spreading it. And the person who is having this fever, we should now at present, we have the facilities in our country also, wherever they are, it should be kept in isolation. The important point in isolation, it has to be under negative pressure so that whatever he or she breathes, it should not come into the other rooms or in that room. It should go outside the room.
India has evacuated so many...
Evacuated around 647 to be
from
precise.
Wuhan, which is the epicenter of the outbreak. So do you think it's going to be safe?
It depends upon our people also, how much they understand it. We have evacuated 647. But right now the figure is persons still have got that infection. And these three can transmit how many we do not know. Till if we do not take all the precautions. And we do not know how many have come. 647 of the people whom we know have traveled back to our country under control. But there are many who have come before that. And it is a long incubation of 14 days. And the problem also is, within this 14 days also, if we talk about incubation period, the incubation period means is the virus enter into my system, but it is not giving any kind of symptoms to me. After 14 days, I will come to know that I am having such kind of fever. But during these 14 days also, I am transmitting infection to others. The person who is infected, he is transmitting this infection to others before he gets the symptoms. That period is a long period and a very dangerous period in that sense. Secondly, there is another kind of people who have not come from China, but they are coming from rest of the world to India. Wherever you say, word has become global.
So airport screening is important.
Airport screening is important, but how you can screen unless and until people get educated. Because he or she may not feel, as I said, 14 days is a long incubation period. Airport screening is just for that purpose of they will do a temperature check. Rest of things they cannot check. So people, if they hide themselves that they are not having any fever, any symptoms of such kind, obviously if you are coming from that, you can check the visa of those people, but rest of things you cannot check. So people have to be educated. They have to be responsible, feeling if they are having such kind of any symptoms, they should report, they should come out openly. Rather, I will appreciate this medical student also, the first one. I came to know that she herself has come to the hospital saying that I have traveled and I am having such symptoms. So these kind of people are required to tell the truth. Do not hide the truth.
And Government of India is taking a lot of measures. They are trying to send out material. They are trying to educate people, create awareness messages that what should be done in case you develop symptoms and you have a travel history, or you know somebody who probably traveled from China and has developed symptoms. So do you think we are doing enough?
You said government is doing, but with a huge population, I see that these things is not percolating down the line. So we have to educate our medical professionals. We have to educate our masses, but I still feel that it is not enough. Our media, I will say, newspaper are doing a good job. Every day on a headline it is there that so many people are affected or not. But government media side should be doing more. Because it comes, then we have a problem. Like China, we are a huge population density. And this is traveling from one person to another by means of, I will say, contact, because my hands are touching everywhere from this way, and second, the respiratory. So these two things are huge problem wherever we have a population density. China had more number of cases, and if India comes into that also, we will also have, unless and until our people are get educated, people are aware, I feel more need to get. One such program which we are doing today, I think these are required more frequently.
But since the outbreak was reported 31st December 2019, we have had only 3 cases reported so far in India, which is a good sign, I would say.
It's a good sign is that our people were not traveling more to China. In that period, nothing has been done. No country has done such kind of. One good point is that though being a communist country, China has come out openly for this. So we appreciate the effort of Chinese government, which always say they curb those things, but today we appreciate that they have come out. So only see the bright spot here is China is coming forward in giving the information.
Even WHO is involved at the highest level.
WHO comes later on. First, the local government in a country, they report to the WHO. Suppose anything happens in the country and WHO, we do not inform WHO, how WHO comes to know. And now, yes, WHO has always come forward whenever such calamities have happened, such epidemics have happened. They are always very fast in coming out about the preventive measures and all those things. Because of the WHO, although we are coming to know that 150 people outside the world, outside China are also affected. Only through them, their research team is working on the vaccination part. In Australia and some other countries where WHO presence is there, and some pharmaceutical companies are also working on production of a vaccine.
How long before you think vaccine can be created or developed?
If I tell you the procedure, what happens is, for a production of a vaccination, one is we have to do the genetic coding of that, which we have done. Then we have to replicate that virus or a bacteria into a laboratory, which has happened. But then it is a trial which has to be done. Today, talk about a vaccination, and then these trials are, what is that part of a virus which will produce antibodies in me so that if a virus attacks me, it is not effective. So it is a long process. We do not know which part of the virus is producing that kind of a protective antibodies. We are successful in replicating that virus today, but trials which will happen, minimum of 6 months will take. So in this 6 months, is a long period. I said that it is a very highly transmissible virus. So this 6 months, only thing left with us is precaution and nothing else, because there is no antiviral drug at present which we can control with this. So only controlling method with us is precautions, that too hand washing and taking care of your surrounding areas, taking care of the patient who is there, taking all those precautions in treating. Rather, I will say today, reporting that case fearlessly to the government, to the health authorities, so that appropriate action can be taken. If these 3 students would not have come, that kind of awareness would not have been there, then probably these would have multiplied so many. Even this, we do not know how many people they have multiplied, because as I said, 14 days is the incubation period, which is a long incubation. During that time, wherever they have gone, they must have spread it. So as per my report, for the first case in which her contact tracing has been done, and around 58 people in Kerala are being watched under observation.
Community surveillance.
Community surveillance. So these kind of things are very important. But this can happen when the few cases are there. But if it becomes large cases...
So hospital quarantine is important only when you develop symptoms.
When you develop symptoms, because before that you do not know. Before that, if the contact history is there, like people who have come from China, our students, most of them are medical students, 640 odd around number, they have been put in quarantine. They don't have any symptoms at present. But because of a long 14 days incubation period, and during that period, they can transmit to others. So 14 days they have been not in a hospital, but in another environment where they will not be able to meet other people outside the world. So this is one. But as soon as the symptoms develop, you have to be in a hospital, in a quarantine, which I said, ideally, it should be a negative pressure room. The patient here is not going in the other parts of the hospital, it is going out in the environment.
But China did act very swiftly. I mean, they shared the genetic sequencing with the world. They have created a 1,000-bedded hospital in about 8 days.
They said 10 days, but within 9 days, they have been able to build a hospital of not 1 bed, 1,000-bed hospital they have been able to build. So that is really appreciable things about China. We must appreciate the effort of Chinese government that they are forthcoming with the information. They are building up hospitals, and I've heard that another hospital is in the pipeline of 1,000 more bedded for the patients. So good things have happened, and we hope that our Indian government is also working on that. We'll be able to curtail this virus.
Thank you so much.
Thank you.
You were listening to a discussion on government initiatives and preparedness for coronavirus. The participants were Dr. Narendra Kumar Saini, former Secretary General, Indian Medical Association, and Rhythma Kaul, journalist. This program was produced and presented by the News Services Division of All India Radio. This program is also available on our website newsonair.com. You can also follow us on the News on AIR app for updates. You may email your opinion about this program at airnsdtalks@gmail.com.